choice. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. You may be seated. Is there a motion to approve the minutes for July 13th?
So moved.
I second.
All those in favor say aye.
Aye.
Is there a motion to approve appropriations ordinance number 29?
I move we approve ordinance number 29.
I'll second it.
All those in favor say aye.
Aye.
I'll declare the public input session open for any item not on the agenda. Seeing none, I'll ask the bench if they have anything.
No, sir. Not at this time.
Okay. We lost a civil rights leader in John Lewis, representative from Georgia, part of Martin Luther King's group. There are a number of things I don't agree with on John Lewis, but I do agree on his approach to try to change in a peaceful manner. And he walked the talk continually, and he was met with a lot of adverse situations initially, but he hung in there and kept his philosophy to the end. So I wanted to say something about him.
Good.
As they honor him nationally, and it's a peaceful voice that we will miss. Okay, I'll declare the public input session closed. Is there a motion to approve the agenda as distributed?
So moved.
Second.
All those in favor say aye.
Aye.
Okay. The first item on our agenda is COVID-19. I am going to let any of you to say what you want. If you've been here before and you have something new to say, fine. If you want to repeat what you said briefly, that's fine too. If you've never been here and you want to say something. After that, I would like to share a ranking system from the Harvard Global Health Institute, and I'm going to give you about 7 counties and where they're at as of Saturday's data. There wasn't anything beyond Saturday this morning, so I'm sure maybe by our meeting over it will change again, but I will give you the ranking and where we sit compared to 6 other counties around us. So I'll give you that information too. And then we have a couple of, our discussion will be whether or not we adopt an ordinance, whether we adopt an ordinance with a trigger, which would be related to the Harvard Global Health Institute ranking, or that we don't do anything at this time. So I just sort of prepare you for what we're doing in this item. So with that, I invite anyone here that wants to make a comment to come to the microphone, tell us who you are, and make a statement on what you would like to say. Congratulations, you have more than one T-shirt. It was green last week, it's blue
Yes,
this week.
yes. And I do want to say that these T-shirts were printed by Stewart's, and I used, for the first one, I used my money from the government. I said, I want to support a local business.
Good.
I'm Annette Carr. I'm a massage therapist here in McPherson. And wearing these T-shirts brings up a lot of conversation. And I learned a lot about the perceptions of the people of McPherson. One that really hit my heart was, if I knew God, I wouldn't have to be protecting myself. Yeah, that I let that go. But I had a very interesting conversation with a man who knows the science. And he was treating this just like, the flu. And he said, we've only got 15 active cases right now. But I said, at what cost? I myself, my business had just plummeted. I only take people that I know who are staying put. I have a client who works at Walmart who desperately needs a massage, and I've had to say, no, you are too exposed. But I also said to him, there's a large population of people in the nursing homes that have been incarcerated since March. I mean, there's been a lot of sacrifices that have occurred. And on a personal note, I have clients at the Cedars, and I also have a client from Disability Support. She was one of the ones that contracted the virus. I stopped practicing very early, even before the governor had said anything, and also the Cedars. There was a small window of time where I could have easily brought that virus into the Cedars. And if you don't think that haunts me, it does. Now, in this perception of business as usual, we only have 15 active cases. If I had brought that into the Cedars, if there had been a large number of cases, just like in Washington, if we would have had a number of deaths, would that make the preventative element more valid? This is a simple tool, and it's not something that everyone can use. I know this. There are some people who I work with the STEPS program. There are people who have had trauma in their life, and to wear a mask is very difficult. I understand that, but for the average person, for most of the people who resist, they are not dealing with that. And like I said, I am haunted by the fact that I could easily have brought that into the Cedars. And our perception and what we're talking about right now would be a lot different. Thank you.
Thank you.
Anyone else that would like to make comment?
Good morning, everyone. I'm Dr. Sheila Gorman. I'm a family physician here in town, also chief of staff at the hospital, and the medical advisor to the health department. So I'm in favor of the mask mandate. I spoke here last time, and I'll not repeat it. But since then, some things have changed, and nothing unexpected. We've had new cases. We're now up to 109 cases. We've had involvement of another nursing home. We've had involvement of some staff at the hospital. This is getting kind of tricky on wearing my hospital hat, because now people, staff members that are exposed there, we have to quarantine, and working on small departments, we have to figure out how to not close those departments. And both the nursing home and the hospital, of course, how did they get exposed? Well, it wasn't at the nursing home. It was bringing it in from the community. It has to be. Like you said, the residents have been there and stationary for months now. It's brought from the outside. And so it's from the community involvement that this is spreading to our institutions where we're pretty fragile. So on that front, that's one of my arguments for wanting to have a mask mandate that will decrease community spread. There is lots of data to support it, and I know you read extensively and gave me your references, which I thought were good ones. But another important aspect when it comes to the mask usage is that by decreasing the community involvement, that's where we interface between medicine and economics. We can't really progress on from phase 3 to phase out until we have less community involvement of coronavirus. And we've seen other communities that have had to go backwards in their restrictions. And just as I'm watching in the hospital and we're having to shut down and really restrict what we can do and figuring out how to cover all our bases, then community businesses are having to do the same thing as their employees are quarantining and getting exposed. So that's, the two are important, the economic aspect of it, the medical aspect of it, and they are related. And from whichever angle, whatever moves you, I think from both angles, we can make a strong argument that a simple intervention like wearing a mask will make a big difference on both fronts.
Thank you. Someone else?
I'm Dr. Dan Lichty, employee health at the hospital. I have this if anybody would want to see what I'm talking about here. And I also want to speak in favor of the mask ordinance. Basically, what we're trying to do here is keep the infectivity down, which you want to make it so that on average, one person who has coronavirus infects less than one person. That's an R naught less than 1. So otherwise, if one person infects more than one person, it's just going to go and grow and grow and grow in our community the way it is right now on a national basis. And our goal here is to keep the businesses open and be able to open the schools and do all the things that we love to do. But we have to get that R naught under 1 so that the disease will eventually die out. So how do you do that? You limit close contact with other people, close contact being closer than 6 feet for over 10 minutes per the CDC. You wear a mask, you wash your hands. So I've made some recommendations there, and I'm sorry I wasn't here for the last meeting. Maybe you've already covered some of these. But there are some things that you can do to get us ahead of the curve on this, like requiring anybody that enters a city building or county courthouse to wear a mask, and supporting the ordinance. Also, I think we ought to start thinking about getting ahead of the curve a little bit. There are already 2.5 billion doses of vaccine in production. So the other way you get R not less than 1 is to get part of the population vaccinated. And with a infectivity rate of 2.5, because right now, coronavirus, the average person that gets it infects 2.5 other people. You have to get that under 1. So how do you get under 1? You have to have some people vaccinated. So it takes a 60% vaccine rate to get R naught under 1. And maybe you're aware, Pfizer is one of the companies that's already gone into manufacturing vaccine even before phase 3 approval. So AstraZeneca and Pfizer have both moved into production phase before they have complete approval, so that as soon as it's approved, that vaccine is ready to give. So to be ahead of the curve, we as a city ought to be thinking about what are we going to be doing about encouraging our folks to get vaccinated so we can get everything open as quickly as possible. Thank you.
Thank you,
Thank
Doctor.
you, Dr. Lichty. Okay, someone else?
My name is Tracy Miller. I do have a couple questions on the ordinance.
Sure.
Are the businesses supposed to supply the mask, or is the city supposed to supply the mask to these people? And are there going to be education to the public on how to wear a mask and how to take it off and sanitize afterwards? I do work out at Pfizer. We read on how to take off a mask, how to sanitize afterwards, and putting it on and off and stuff like that safely and not contaminating anyone. So is that going to be out there for the public to know?
Yes.
Are the businesses or the city going to supply masks to the people that don't have them?
In most locations, the businesses have had a small amount of masks available. We had not made any provision for the city to supply them, but if there's a short supply, we have been looking around to see what we could do so that we could be contacted for masks.
Well, I'm just asking
Yeah,
before,
no, I'm
before the
just
cart,
answering. Yeah.
before the cart gets before the horse
Yeah,
and stuff.
that's right. And there is a time lag for when this would go into effect. so that we would have time to do those things.
Okay, thank you.
You're welcome.
Thank you.
Thanks for coming back. Someone else? Okay, I will move forward. I'm going to share a personal thing first, and then I'm going to go into the governor's call to elected officials on Friday afternoon with Dr. Norman, and then I'm going to move to the Harvard Global Institute, Harvard's Edward J. Safra Center for Ethics, and go through their ranking there. It's interesting, in church last night, the first stanza of a hymn, out in the highways and byways of life, many are weary and sad. Carry the sunshine where darkness is rife, making the sorrowing glad. And the chorus to that is Make Me a Blessing. Some of you may know that, but that's what we're trying to do. We're trying to slow down community spread. How do we do that? Can we do that voluntarily? Do we have to have something else to help us be a blessing to each other? Okay, the governor on Friday afternoon started her conference about 3:30, ended about 4:15. Dr. Norman was the biggest part of that conference. We have a spike where we had over 1,900 cases in 2 days in the state and 7 deaths. And the report will be coming out late this morning or early this afternoon on what's happened over the weekend. One of the biggest things that has led to this, at least from Dr. Norman's viewpoint, is that we were very careless on 4th of July. And we will continue to see some of those cases, and I think we see that locally. Last week when we came in here, I think we were just about either 94 or 97 cases. Now we're at 109 already, and a lot of that is coming out of the 4th of July. And how many people did you contact? Dr. Lichty said, you know, on average, we may expose 2.5 people. But when you're in a crowd, you're exposing more than 2.5 people. Nationally, we say sometimes in these groups, you have exposed 10 people. So if we add 12 people this week, in just a week, we probably had 120 out there if we tested a lot more on this. And the people that we're testing are symptomatic, not asymptomatic. Out of all of the ones, 109 so far, we have only had 15 asymptomatic. So these are, 15 from 109 is what, 94 are symptomatic. These are people that get sick. And that, out of that conference with the governor and Dr. Norman, 3 questions came up. One, we're concerned about the economy. We have taken a stance as a commission that we want the economy open. We wanted the economy open when it was stay at home, because we believe that the economic pandemic could be worse than the health pandemic. So we are supporting that all along. There's no doubt, if we have to close again, anybody that was marginal coming out of this thing will probably go down. We do not want to see that to happen. So we are looking for how can we slow community spread, help each other, protect each other, and keep the economy in McPherson County, city of McPherson, going forward. I was also asked a question on masks. I'm sure we'll get a clarification whenever the executive order is officially ordered today, but she did say she expects for masks to be worn K to 12. So that's about sixth grade through high school. And she cited a thing in Florida study of school kids, 30% of kids are testing positive. So that's, you know, the problems that they're having. So how do we bring school back, which is needed for a lot of kids, and go forward? And the last question she covered in her thing is, what is support for another federal stimulus package? Would she support it? The answer is yes. I think everybody across the country knows there has to be something in there for small business, or maybe something in there some way for people themselves again. And we lose revenue to keep up the services to you as local government, so we would like to be included in some bill in what we do. Okay, I would like to move now to the Global Health Institute and the Edmund J. Safra Center for Ethics. They've done a lot of studying, and they have 3 metrics. The first metric is new confirmed case trend, new daily cases per 100,000 population. So we don't have 100,000, but that's what the calculation is based on. So it takes us of what we would have had if we had 100,000 to come up with a number, and that's the same if you're a million metropolitan area, it will do per 100,000 on that, and that is on a 7-day rolling average, and plus we're looking at the trend direction and the rate. So that's one metric. The second metric is case trend as an estimate from new deaths trend. New daily deaths per 100,000, and that assumes a 1%, 7-day average with same thing of trend and rate. And the third metric is the daily hospitalization per 100,000. So what they did is taking all that, and this is just a Kansas map. You can look at the whole United States, and you would see the whole United States, but there are 4 categories. And I know that I'm simplifying this, so those of you that read the study are saying, wow, you left off a lot of detail. Well, I don't think we want to go all to you. The green zone is like the R naught less than 1 that Dr. Lichty talked about. And it's the daily new case per 100,000. So if we were getting less than 1 case per 100,000, we would be fine. The second category is yellow, between 1 but less than 10. And that's the daily case again on that 7-day average. The third category is orange, and that's the daily case between 10 and 25, and red is daily cases per 100,000 over 25. So without going into a lot of detail on this, you know, you can pretty much leave life as the old normal if you are in green. If you are in yellow, there are strategic choices that must be made, which have non-pharmaceutical interventions. Washing your hands, social distancing, wearing a mask are the 3 popular non-pharmaceutical interventions. When we get up to orange, we start to see that we may have stay-at-home orders. We have to have contact tracing capacity, a number of other things, so we get a handle on where is the exposure really at. And then when we're at the red, we're at stay-at-home, period. And we will do all the things. Now, I would just throw in here a little aside. A lot of people have said to me, well, look at Japan. What they did, they wore masks, for those of you that support masks, and they have had hardly any deaths, and they've made almost a full recovery. That's true. And they also stayed at home a lot longer than we did and were much more restrictive. They also use the nebulizer, and I can't pronounce or remember the actual steroid that's used to do that with the nebulizer, but some of them use that too. What was the real case? But we know for the most part, they had strict stay-at-home. We do not want to have a strict stay-at-home. They had a mask requirement. We could do that. And I think if you want to use the nebulizer, you want to take President Trump's preferred pharmaceutical, you want to do something else, that's up to you. You have the freedom to do that if your doctor will give it to you, I guess, write you a prescription. Okay, on all of these different counties, I'm going to give you McPherson County first. Last week, McPherson County's average daily new cases was 6.5 on a basis, remember, of 100,000. So we're all comparing on the same basis. As of Saturday, we're 5.5. So we went down one person in that trend. Our risk level is yellow. And so you can see that. You might want to just put the risk levels up, so I'm going down if you want. I can read the ones where your pointer will go. Harvey County was below us for a long time. Now they have a cluster, and they've had 3 deaths. Last week they were 15.8 average new cases on that 7-day. This Saturday they were at 17.4. They're on a trend up. They are in that orange category in the bottom left there on the screen. And so they voted to go ahead and mandate masks. There's starting to be a serious problem there that they want to nip in the bud before it grows very far. Saline County was 18.2 last week. This week they're 14.5. They're in an orange category, the same now as Harvey County. They've required masks. They've had 3 deaths, and Harvey County has had 3 deaths, if I didn't say that too. So we're on the move. Reno County last week was 10.4 cases on an average. Their risk category was orange. Saturday, they were at 7.8. They have mandated masks. They dropped a couple of points, and they moved back into yellow. Rice County was at 7.5. They stayed at 7.5. They picked up 3 more cases, no deaths. They remain in the yellow. The big one in our area, and some of you may go there, new cases last week for Sedgwick County, 18.6. And their trend has moved up on average to 19.8. They've been in orange category both weeks. They're now up just under 2,800 cases, and they've had 32 deaths. They have a major problem in trying to slow this as a much larger community. Marion County was 14.4. They were orange. They had a very small number of cases, 24, but they had a death. That's what kicks them into the orange. This week, as of Saturday, they only had an average of 6. So that's a good drop. And they're back into the yellow. They picked up 3 new cases, but they haven't picked up a death. I share all that with you just to say this is not a political football. I do think that it's about community health and safety. You know, if we make a decision, and I'm saying if, that doesn't make me a communist, a Nazi, Marxist, and all the other things that the email call us. And it's going a little bit overboard. I wore my patriotic tie again. I fought for this country. I established churches in China. I have worked with, in defense of Christians to get a genocide through the Congress, which we did for the Middle East, and I'm opposed to all the things you call me by actually doing something. So this is not a political thing. It's a health and safety thing. And so at this point, I would like to call on the city attorney to go over the ordinance and to explain. The ordinance changed a little bit from last week. Not much, but he will go through and explain a piece before the exceptions. He will tell you why we have to have exceptions, and then he will cover, there's only one small part in section 2 of whether we would have a trigger or not have a trigger. Okay? So it's all yours.
Thank you. I think it'd probably be best to kind of go on a chronology of the three major ordinance types that the city has been looking at. I will save you the various drafts that have been discussed and just talk about the three broad ones. Last week, attached to the board docs was an ordinance that mirrored the governor's order. So it's the one that the governor put into a ordinance format. It also parallels every county that has not opted out and every city in the state that has passed an ordinance like it. So they were all identical. Lawyers love to plagiarize, and this one was no different. The difference for the McPherson version from last week was simply in the punishment structure. The other cities at that time had all declared them to be misdemeanors and run it through the normal course that a Class C misdemeanor would be in the state of Kansas. This governing body advised me to have it more like a seatbelt violation. So it was a $10 fee, and there were no court costs. So it was a much lesser punishment structure, if you will, on the ordinance. Since that time, several other cities have adopted that model, where it's a $10 no court cost kind of fee, and that seems to be trending right now for the cities that have adopted it.
Yeah, we have shared ours even though we didn't pass it.
We city attorneys like to talk on the backside, okay? The second ordinance that is out there for consideration and was put on board docs also has the decreased fine structure, the $10. It also has a sunset provision, so this will not last on into the future. But it removes the requirement that businesses ensure that customers / employees, etc., are wearing a mask. In other words, the second version of this ordinance indicates that it is a personal responsibility to do this as opposed to a corporate or something like that, and an attempt to get out of the policing the front door. However, you will note that a lot of the big box businesses have already nationally mandated this. Many of the businesses here in town, the smaller ones, are also mandating it. But that is left up to the individual businesses if they want to do that. The third version of the ordinance that is out there includes everything in 1 and 2. Okay, so decreased fines, sunsets, no businesses. But it has a trigger mechanism in it. 72 hours after the Harvard study shows McPherson County or the city of McPherson going to orange or red, orange or above, the mask ordinance becomes mandatory. 72 hours after it becomes yellow or green, I have written the trigger so it toggles off, if you will. So it's a toggle on, toggle off kind of a system. Those are the three versions of the ordinance that have been given to the governing body at this current time to consider. But there were questions on why lawyers have to make everything so difficult and have all these exemptions in there. So I wanted to go over the exemptions that, like I said, are uniform throughout the state for every governmental entity that has adopted this ordinance, just to give some idea why we write it the way we write it, because I wish it could all be on one piece of paper too, and that's not the world we live in. The first exemption from wearing a mask in all three ordinances is persons under the age of 5 or under, especially 2 or under. That is based upon the medical advice that was given for the risk benefit for the smaller children. And as a father of 4, it may reduce all kinds of misdemeanors and felonies trying to keep a mask on a small child. So there's a practicality element for the smaller children. The second one is persons with medical conditions, mental health conditions, or disabilities that prevent the wearing of a mask covering. This is to comply with the federal Americans with Disabilities Act. The city cannot opt out of the ADA. So, to the extent that the ADA will declare a qualifying disability, the city must make that exception for it. Second, hearing impaired, or those who communicate hearing impaired. This is also an ADA requirement. Fourth, when the wearing of a face covering would create a risk to the person related to their work as determined by local, state, or federal regulators. The easiest one to think of here is OSHA. If OSHA has made a requirement for the specific job, you have to follow the OSHA requirement. It is a higher level of law on point, and the city cannot opt out of it. 5 and 6 are more practical. If you're having your nose or face worked on for some reason, you're going to an ENT, for example, or you're actually eating or drinking at a restaurant or other establishment. I have, without remembering I'm wearing a mask, tried to drink wearing it. It does not work. And you look like an idiot while you do it. So it is also a practical exception written into it. Number 7 is athletes engaged in organized sports that can maintain the 6-foot distance. I believe Dr. Lichty mentioned it, but I've also talked with County Health on it, and if you get one of those great tracing phone calls from County Health, they will want to know who you've been within 6 feet with for over 10 minutes. So this is one of those entities or those situations where the health experts have told us that that's an exception that's allowable. The next one.
And this one right here is we're saying if you can't maintain social distancing, you have to wear a mask. So let's say you go into a business, and I did this on Friday to drop off a copy of the ordinance because the person didn't think they could find it on the internet. I'm the only one in the store besides the clerk. She stuck her hand out, I reached out, handed her the ordinance, and left. I'm not there but a minute. We're 6 feet apart. I had my mask on, but I wouldn't have had to under this ordinance because we maintain social distancing. If you have 2-3 people in your store is any size at all, you can probably maintain social distancing. But then again, if you think that's a problem, what could you do to be absolutely safe? Wear a mask.
The next exception is again both an OSHA and something that comes under the CDC guidelines, and that's professional or recreational associations where the public health oriented entity has determined cannot be safely conducted while wearing face coverings. So if you'll remember the hearings that we had whether to determine to open the water park or not, the city followed the CDC guidelines on that. It's hard to swim in these masks just like it is to eat, but as long as we're following the CDC guidelines for that particular activity, that would fall under there. The next one is straight separation of powers. This city, the legislature, etc., cannot mandate to the courts whether they will wear masks in the courtroom or not. They're an independent, co-equal branch of government. I will tell you that the courts have been requiring masks for a long time, and we have no choice on the matter. but it's not through city ordinance or state law. It's from an order from the Chief Justice of the Kansas Supreme Court. Next one. This is a catch-all. Everybody likes to have a catch-all at the end, and it's for persons engaged in any lawful activity during which the wearing of a face mask is prohibited by law. I have seen a lot of chatter on social media that this has something to do with concealed carry. It does not. There is nothing in the Kansas concealed or open carry statute that has to do with face coverings. But if you were watching Friday, I believe, the Kansas Secretary of State came out and said you cannot be prohibited from voting by not wearing a face mask, because that is also a constitutionally protected right. So if you want to vote without a face mask, that's what this exception would cover. The next two are McPherson exceptions. The number 11 I actually stole from Sedgwick County, and it basically is persons engaged in religious activities protected by the First Amendment. Although we highly encourage in this exception people to still wear masks at church, synagogue, mosque, wherever you're happening to go. But because of the constitutional entanglements, this exception was deemed appropriate. And the last one, although I believe it's already covered above, to keep any further confusion, persons at the McPherson Water Park, so long as protocols announced by the water park, which are those CDC protocols, are maintained. So you don't have to swim wearing the mask. Now the mayor alluded to when do you have to wear a mask. I went over the exceptions first. Times that you are required by all three versions of the ordinance to wear a mask are inside any indoor public space where distancing of 6 feet is not at all times is not possible. So you've all seen the pictures of the bars and the clubs and things like that, where everybody's all smushed together doing what you do in clubs and bars and stuff, I guess. It would apply in those circumstances. 2, in line and waiting to enter any indoor public space. So although the water park does not require a mask while you're swimming, while you're standing in line waiting to get in, they would be required to wear masks standing waiting in line. 3, obtaining services from the healthcare sector unless directed by an employee or the provider to remove it. So while you're sitting in the waiting room waiting for your doctor's appointment, you would be masked. If you go in, you would be masked, but if Dr. Gorman says it's time to take off your mask, I need to look in whatever you're going to look in, that would be the time that you would take it off. Next one, riding or waiting for public transportation. And the last one is while outdoors in public spaces and unable to maintain 6 feet distances between individuals. So if we're at a high school football game and it's Bueller and the stands are packed, because that's what's fun to do with Bueller, that would be a time when you would be wearing the mask. So that's how all three versions of the ordinance are structured, with variations, and all of them have pros and cons.
Okay, I want to emphasize that there are reasons behind every exception, and that in each of these instances, we're assuming you're going to wash your hand. And we're telling you, if you can maintain social distancing, then you can avoid wearing a mask. But if there's just no way you can do that, then you should have concealed carry, a mask in your pocket that you can put on, okay? There are going to be times when you can't avoid it. One of the reasons why I always wear a sport coat is I have something in here that I'm ultimately going to need. So if I'm out and I don't have my mask on getting out of the car, I try to keep it in my pocket so if when I go in, I can put it on. And I always ask the people, even now, what do you prefer? Can we keep social distance, or would you prefer I wear a mask? And you can do the same thing under this ordinance, but we are going to do that. Now, the other thing that we need to talk about on any one of these three versions is how is it enforced? And I'll ask the city attorney first, how he sees it enforced, and then we'll try to see if we agree.
Ultimately, this is written as an infraction, so it is not a Class C misdemeanor like it is in the other cities that have adopted this ordinance. It is set up as a fine of $10 per occurrence, with court costs which can run over $100 not being assessed. If you look at the Wichita ordinance, which was the first city who basically went opposite of the counties that they were in, and now many have, they quickly hit 500, I believe, if I remember right, as far as multiple occurrences. We have no escalation structure like that. This is, since it's an infraction, I would not anticipate that PD would be responding to 911 calls for masks. That's not how this works. So it would be more in the realm of a parking ticket and a tool that if we have a situation that is clearly in violation, it can help to be mitigated and spread out if they become involved. But I don't anticipate any 911 calls on it.
Yeah, and I really want to emphasize, this is not a 911 call if you see a violation. If you have a problem with something, you can call the police department directly and not 911. We cannot overload 911 dispatch.
That's
I think it will be a lot like other things. We are not going to go in and out of businesses looking for violations. If something is brought to our attention, we'll check it out. And that works a lot like 4th of July fireworks. You get a call from somebody and says, it's 12:15. They were supposed to stop 15 minutes ago, and they've just left off 3 barrages. So we sent a patrol car to the location. It is dark and dead. There is nothing to do. The same as if you're playing your boombox and you shut it off before we get there. There is no noise when we get there. There is nothing to do. So we sort of have to be in the middle of the evidence. And if we happen in somewhere and that happens, I will hope that each business person would get a warning till we've adjusted to this and we continue the thing. So, any from the bench, any comments from commissioners, and then I'd like to decide, do we want to trigger or not want to trigger, but I want you to be free to make any comments you want to make.
I'm in favor of leaving it like it is, $10. But there's a little common sense involved in this, and I don't know that that our officers on the force, they've got a little common sense as well. They're not going to go out here and write a ticket because you took your mask off 10 seconds before you should have, and they happen to be standing there. Let's use a little common sense in going around this and work our way through it. Now, if you have a person that walks into Tractor Supply with no mask on, and you go through the store and do this and do that, and somebody asks you to put a mask on, and you tell them you're not going to put a mask on, that's a different thing. So, at that point, something needs to be done.
Yeah, and that brings up a good point. I want to hit a point here. Starting today, Walmart requires a mask for all employees and patrons. Walmart asks you to put on a mask. You do not want to put on a mask. If they call us, we will go out there and we will try to get you to put on a mask. If you don't put on the mask, we're really removing you for trespassing. And that is not a mask violation, and that's a bigger problem. So remember, if any business or medical deal or whatever, and you decide you're not going to comply with what they have dictated on their own, and they turn you in, it's the trespassing, not the mask, that's going to get you in trouble. Okay, Gary, you have any comment?
Mayor, I just like to say, I've never been a big proponent of mandating something like this. Be very truthful with you, I really like this Harvard Institute idea that you've got there, and I think that's probably the way that I would want to go. I tell you, whether we mandate a mask or not mandate a mask, I'm wearing a mask. I don't like them, I hate them. They fog up my glasses. I can't breathe well through them, and I'm wearing glasses and hearing aids and throw one more thing over my ear, just about more than I can stand, but nevertheless, I'm going to wear it. So I would just like us to, Mayor Brown 3 weeks ago, he encouraged everyone to please wear masks and just to voluntarily do it. And I tell you, I've been around town and I've noticed more people wearing masks than I probably ever have. I think that's working. I'd like to be able to encourage people to continue to wear them, not because of a mandate, but because you care about your brother. It's a good Samaritan rule is what it is. You know, look out for your fellow man. You're the one that's going to protect them. So from that standpoint, I would definitely be in favor of probably the second,
And of
Very
having,
good.
having a trigger,
the third. Yep.
okay? How would you feel about a trigger?
I'm in favor of people wearing a mask. You walk into a place, you need to put a mask on. And time and time again, we've tried to encourage people to wear a mask. We've tried to encourage the citizens of McPherson to wear masks when they go someplace and wash their hands and one thing or another. And we have 2 facilities that we opened up, and in both cases, we had some requirements, and they were basically requirements that were almost like, well, we'll read them to you, and that's about as far as we're going to go. And in both instances, it's not working. It's not working. The social distancing is not working. You go places, I went out to the facility the day after we said you can open, and there was supposed to be social distancing, and there were 4 people standing there within 15 inches of each other. And there were another 6 people standing another place the same way. So we need to push this thing. I'm not advocating that we put it in gear and leave it there till Thanksgiving. I'd like to see it put in gear and go for 30 days, and after 30 days, take a look at it.
Yeah.
If it's not working, then we'll do something else.
Our ordinance right now goes to September 9th,
That's correct.
the day after Labor Day.
Mhm. And I would agree to that.
Okay, I guess it comes down to me, we declined in average cases according to the Harvard Global Health Institute. That doesn't mean they're missing some cases, so it's not as timely as the health department is. But I would like to see that we move out of yellow. If we continue to improve, if you will continue to increase your voluntary use, and there's been a lot of emails, you know, think about your right, but it's your right until you violate somebody else's. And if you give it to them, you just overstepped your bound, in my opinion. So, do the best you can. Let's use this ranking of a trigger, and if next week we go to orange, or on Wednesday we go to orange, we will automatically move, or we will have to have another meeting to vote that in. From my standpoint, I would like for it not to be automatic, but we would have to have a meeting and vote for it to happen when it moves to orange. So that we are gonna give 72 hours from that meeting. We will continue to try to put out more educational information on masks. We have plenty that we can get to. Sydney can put that out. How do you put your mask on? How do you take it off? If you use a cloth mask, you need to be washing it. If you have a pouch inside your mask like mine, I have a surgical mask inside my cloth mask. How should you be changing this type of thing? And from that standpoint, so I would like to move that we use the Harvard Global Health Institute and the Edmund J. Farah ethics to use the 4 ratings, and if we are able to stay in yellow or green, we will not have a mandate. But if we go to orange or red, we will have a mandate because volunteerism has not been working. And that we will have a special meeting and that the ordinance would go into effect. But I think you can use this, it's out there, and look at all the exceptions and how you can do a good job in your church, how you can do a good job with these youth programs that are being run on weekends, how you can respect everybody when you go to a medical facility. All of these things, we are known for being able to be a cut above in McPherson County. Here's your chance to prove it within health and safety. Can you get this done? Can we stay at yellow on your initiative? If we can't, we will make the move to mandate it. But that would be my move, that we have a trigger and it will be exercised as a vote of the commission, and we will put this ordinance in place at that time. Is there a second?
I'll second that.
Okay. Discussion.
Point of clarification, Mr. Mayor. As I understood it, Commissioner Mell was in favor of the trigger, which had a special meeting vote or an automatic after 72 hours.
Yeah.
Commissioner Weens was in favor of implementing the ordinance now without the trigger. If I
Correct.
understand you right, what you're saying is if the Harvard metric trips to orange or higher, then we would have a meeting and then you would pass the ordinance, so there's actually no ordinance to pass today.
Correct. The motion is to use the Harvard Global Health Institute or J. Farah data to bring us to a point where we need maybe even a special meeting to consider a
Okay.
mandatory ordinance.
Thank you.
Okay? Thank you for the clarification. Any other clarification is needed? Okay. All those in favor of the motion say aye.
Aye.
Opposed?
Aye.
Okay, passes 2-1. We will stay on a voluntary basis as long as we stay in yellow or green. If we go to orange, we'll call a meeting. and we will consider mandatory, and I think from what you've seen today, there's not much consideration that's going to probably pass. So it's up to the community. How much do you want to look out for each other? How much are you willing to be inconvenienced from time to time? I tried to keep track of how often I'd have to wear my mask, and I don't think I wear my mask, and I'm out and around in the community. I don't think I wear my mask more than an hour a day at most. Maybe not that. I'm going to tell you another thing that you can do. When you check how much we're driving all around, I think we're at a D- right now on that metric. So that means you have to be buying gas. You're going to a service station, a convenience store. And if you have access to a latex glove, put your latex glove on, and then take it back off carefully and put it in the trash at the service station. You do not know who had their hand on that pump right before you. And that may be one of the ways why we get an unknown. I don't know anything that I did. We forgot we bought gasoline for a vehicle. So try to do that. Every once in a while I forget. And then when I get home, my wife said, "Did you wear your glove when you got your gas?" And I said, "No." So now I got them in a place where I can see them in my car to do that. But it's an easy thing to do. Some of the service stations, if you go that are convenience stores, have a plastic mitt inside that you can use. And then when you're done, if you want, you can use their hand sanitizer station. So all we have to do is a little bit of personal discipline, and if you do it all the personal discipline, you maintain social distancing, wash your hands, don't touch your face, don't let your kid suck his thumb. We'll be in business. Okay. All right, I'm going to move on to police department matters. Thank you all for coming for this.
Morning, Mayor, Commissioners.
Morning.
I have one item, motion to approve making a conditional job offer to Cheryl McVicker for the position of crossing guard supervisor, and to Charles Brown, Joe Cappuccino, Dan Kate, Shirley Combs Jeffrey, Danny Elder, Gary Eli, Della Keogh, and Michael Ells for the position of crossing guard, pending successful pre-employment requirements, effective August 17th, 2020, which school has been moved into September, but we'll have that taken care of then, for the 2020-2021 school year.
Okay, I'll move to approve the hiring of the crossing guard supervisor and a crossing guards for 2021 USD 418 school year based on an agreement with USD 418 for payment of 50% of the related costs. And our best estimate at this time is $44,321.23.
I'll second it.
All those in favor say aye.
Aye.
Thank you.
Okay, call on Wayne Burns.
Good morning, I have one item. It's a motion to approve payment to BPU for annual rental of the fire hydrant meter to fill the water park pool in Lazy River in an amount not to exceed $1,885.66.
I'd make the motion to approve payment to BPU for the annual rental of the fire hydrant meter to fill the water park pool in the Lazy River for an amount not to exceed $1,885.66.
Second.
All those in favor say aye.
Aye.
Thank you.
Call on Jeff Woodward.
Good morning, everyone.
Good morning.
Morning.
First item I have is out of the engineering department. It's time of the year to renew our AutoCAD subscription. This is an annual budgeted item. The subscription is essential for the functioning of the engineering department. We have received an invoice in the amount of $2,237.40 from DLT Solutions LLC from Herndon, Virginia. The subscription runs from 9/13/20 to 9/12/21.
I move that we approve the renewal of our AutoCAD license with DLT Solutions LLC, Herndon, Virginia, for cost not to exceed $2,237.40.
I'll second it.
All those in favor say aye.
Aye.
The next item is out of the wastewater treatment facility. Dennis Friesen has submitted his 2020 farming operations invoice. The total amount equals $16,729.66. This work consists of swathing, side raking and baling, and moving the bales to the side of the fields. This year we've harvested 1,271 5-foot round bales. The invoice is attached.
I move that we approve payment to Dennis Friesen for the 2020 farming operation for an amount not to exceed $16,729.66.
I'll second it.
All those in favor say aye.
Aye.
The next item is out of the wastewater treatment facility. It's sewer truck repairs through Red Equipment. Screen weldments are large cylindrical screens inside the debris body. They filter out large particles in the airstream created by the system centrifuge blower and have to be replaced from time to time. The 4-position switch bank is also not working properly and needs to be replaced. We received a quote from Red Equipment, who is our VACCON dealer, in the amount of $1,490.48, which includes an estimated $100 for shipping.
I move that we approve payment to Red Municipal and Industrial Equipment Company to purchase repair parts for the sewer truck for a cost not to exceed $1,490.48, which includes $100 for shipping.
I'll second it.
All those in favor say aye.
Aye.
The next item is on the Grimes Anna Street reconstruction project, change order number 4 with Votes Parga. The item of seal course was increased for the box culvert at the high school entrance, the cast-in-place section at Grimes and Earl, and the cast-in-place section at Grimes and Anna. A total of 66.65 cubic yards of seal course was used, which is a contract increase of 65.65 cubic yards at the contract unit price of $175 per cubic yard. The seal course was added due to frequent rains. Just a 1/4 inch of rain in the area puts 2 feet of water in the channel. Using the seal course helped to keep the project on schedule and less delay due to drying or recovery days.
I move to approve change order number 4 for the Grimes Anna Street reconstruction project, Votes Parga Construction LLC, to increase the seal course on the contract for an amount not to exceed $11,488.75 and authorize the mayor to sign the change order.
I'll second it.
All those in favor say aye.
Aye.
The next item, when the 24/7 travel store was built, the lot did not lend itself to install on-site drainage detention. The city made an agreement with Property 10 LLC to contribute $15,000 towards drainage improvements made to North Champlin at the time it was developed. The drainage for the Best Western is nearly complete on North Champlin, and we have sent an invoice to Property 10 LLC for payment of the agreed $15,000. Mark Augustine from Property 10 LLC has requested a formal release from the city upon payment. The city attorney has drafted a receipt that will release Property 10 LLC and acknowledge payment of the $15,000. The city attorney is recommending we file the signed receipt with the Register of Deeds since the original agreement was filed.
I move that we approve the receipt and release for Property 10 LLC drainage requirement on North Champlin Street and authorize the mayor and city clerk to sign the receipt.
I'll second it.
All those in favor say aye.
Aye.
And finally, I'd like to give you an update on the construction project we have ongoing at this time. Oh, I'm sorry, first of all, update on the Chestnut Street improvement. CDBG reimbursement number 2. We've turned in our second request for payment of CDBG funds in the amount of $22,000. No action is needed. This is just an update to you on the status of the CDBG grant. Now I'd like to give you an update on the construction projects we have ongoing at this time. First is an update on the Grimes Anna Street reconstruction project. Work continued on backfilling and general cleanup items. We hope again to finish this project this week. No street closures are associated with this project. Next, an update on the Hardup Elizabeth Street reconstruction project. Hardup Street, on the second section, 350-foot section, south of Hancock, the contractor completed work on nearly all driveways and curb and gutter tie-ins. Hardup Street, Elizabeth to Kansas, pavement was removed and excavation was started. We ran into an electric conflict and it should be cleared out early this week. Hardup Street, Avenue A to Hancock is closed through traffic with local access from Avenue A, Hancock and Sites. Through traffic on Hardup is detoured onto Park Street. Hardup Street, Elizabeth to Kansas remains completely closed. Next, an update on the Hulse area drainage project. Work continued on the First Street box as weather permitted. Work continued on pavement for the box at Wheeler, Crescent, and Myers. We should be able to open up Crescent and Myers Street later this week. Hulse Street is currently open, Grimes to North High Drive. Crescent Lane and Wheeler Street, both Hulse to Normandy, remain completely closed. First Street is closed from the high school to North High Drive. Traffic will be detoured on Maxwell, Kansas, and Maine. Next, an update on the Chestnut Street improvement projects. Work on the installation of storm sewer and moving lateral lines continued. Storm sewer should be completed by the end of next week. Excavation for curb and gutter has started. The street will remain open to through traffic, through construction, when possible, but very limited street parking will be available. There will be times the street will be closed, but residents should be able to access their properties from one end of the block or the other. I'd like to remind everyone that weekly construction updates, road closures and detours, and planned road closures and planned detours are available on the city's website at www.mcpcity.com. I'd also like to announce a public meeting with McPherson County regarding the Northview sidewalk. We'll have a joint meeting with McPherson County Commissioners on July 23rd, 2020 at 1:30 here in the commission room regarding the Northview sidewalk. Since more than one commissioner may be present, we need to declare it a public meeting. Anyone that's interested may attend. That's all I have unless there are any questions.
I have one. Several people have contacted me, and I know what the answer is, but I want it on record. Hulse Street is going to be a mill and overlay from Main Street to North High Drive. Is that correct?
That's correct.
And they're asking because basically it's tore up. I mean, it's in bad shape right now. So
It is in
they're
bad
saying,
shape.
what are you going to do to it? And I'll leave that to you.
Okay. And we have received word that the mill and overlays should start Thursday, hopefully. And Hulse and Northview probably won't be completed until sometime next week. But
That's fine. All right.
getting ready to get things kicked off on that.
Very good. Thank you.
Thank you, Jeff. Okay, I'll give you a report on the executive committee meeting last Thursday on REAP, Regional Economic Area Partnership. And two things. One, REAP will become a 501c3 on a 10-2 vote. And this allows us to meet a requirement from Ford that we can get special pricing for every REAP member. And it started out with only Jeff Longwell pushing to have a Ford dealership in Wichita, but the way it came out, if we have the 501c3, which we are starting the process now on the 10-2 vote, any Ford dealer in the state of Kansas that is a person is a REAP member, they can get a Ford special discount, which should be lower than the state discount. So this is something, as we buy vehicles, we want to be sure that we at least get the quote when this is in place. The other thing is, with this, we are going to work to have a lot like Mark in Kansas City area, to have other things, so that if we can buy as an organization, you can buy as an organization, through the organization, you can maybe save money even over state contracts. So we're trying to do what we can. We would hope that members would save more than their dues in a given year, and maybe attract some new members. The other thing that is important is Wichita State University COVID-19 Research Lab. They have put in place, you may have seen some of it on the news, Tanya Witherspoon, Associate Vice President of Industry Engagement and Applied Learning, gave us the update. They will be able to do 10,000 tests per day as they're shooting for their potential. Hopefully that will be in late September or October. The equipment is on order, and it will be done more than just Sedgwick County. And my question was, you know, can you go out to people like McPherson County? The answer was yes. It costs over $100, usually $120 to $150 to do a testing. Right now, with this, we will be able to do testing that will be around $50. So it will be a lot less when you start to do tracking and other things like that. It is not the nasal swab. It is saliva, spit in the cup type of thing. And the goal on this is to be able to get the results back in 24 hours, which is extremely important, because right now we're asking people to quarantine until we get the results. Well, if things go slow and it takes a week to get the results, you could have quarantined for a week and had negative results, and still you didn't work. So we're hoping that we can work together to do this, and it would help schools when they go into session in the fall. It will help businesses that we can get back to work faster. And they're trying to use CARES funding to sustain this for right now, but there may be a need for some help as we come down the road. So those are the big things that we want to take a look at. After that meeting, it came out that the state of Kansas unemployment was, I think, at 7.5. Sedgwick County was at 10. McPherson is at 4.1, which is a lot to say of how we've been able to be addressing the economic crisis. And with our unemployment at 4.1, we're almost at a point of normalcy. I would hope when we finish July that we are below 4. I wanted to be below 5. I didn't think it would go as low as 4.1, but if we can get under 4, then pretty much 2.7 to 3.5 is a normal range for us. And I told them in the REAP meeting, where they have high unemployment in a lot of places, a lot of counties that belong to REAP, we're open for business. If you need a job, come on down. So that didn't get a chuckle. Anyway, so that's my REAP report, and now we'll move on to administrative report, Nick Gregory.
I'm going to defer to Janetta Shepik on the first one, and that's the 2021 McPherson City budget hearing request.
Good morning, Commissioners.
Morning.
Following multiple budget meetings over the last several months, the City of McPherson staff and commission have worked diligently on developing a budget for 2021. The city commission requested a budget that maintains a mill levy similar to that of last year. The proposed 2021 City of McPherson budget sets a mill levy of 52.214 mills. The proposed mill levy is 0.32 mills over the 2020 budgeted mill levy, which was set in August of 2019 of the 51.894 mills, and 0.219 below the finalized 2020 mill levy of 52.433 mills, which is set in November. That's the final, of which city has no control over that November mill levy. A full report of this proposed 2020 21 City of McPherson budget will be presented at the public hearing, which is set for August 20th of 2020 at 9 o'clock here in the City Commission room. And I'm here before you just to request a motion to authorize.
It's August 10th, not August 20th, is that right?
Oh, I'm sorry, August 10th of 2020. My apologies. Here to request the motion to approve to move forward with the notice of public hearing, which has to be published 10 days prior to that hearing date. And also attached is the document that will be published, which once again will be published on the city's website.
I'll make the motion to authorize the publication of the notice of public hearing for the proposed 2021 City of McPherson city budget and set a public hearing for August 10th, 2020 at 9 a.m.
All right, second it.
All those in favor say aye.
Aye.
Thank you.
Thank you.
Okay, back to Nick.
City of McPherson code ordinances from the second half of 2018 until present were recently sent to MuniCode for codification and updated in the McPherson City Code Book. The Code Book, basically all the ordinances that are adopted that impact the laws of the City of McPherson are sent to codify and put into the major code book. It's been a while since we've done that. And there is we work with MuniCode, who's actually the one that codifies it, puts it all together, adds the pieces in where they're supposed to be, and they've given us their quote. It's the estimate, and will come under and they gave us a preliminary estimate, and they've come in under that amount. We're going to cut the amount of copies we order due to the fact that many people now use this online version that we have. A lot of people might have the thick code books in here. Some people use those, but less and less people are actually using those, and so we're going to cut back on the number of copies we make. We're also going to eliminate the folio update, which is not really necessary because they'll update it directly into the electronic. It's just another piece that they had that you could sit through and review electronically. But by cutting that down, we're able to get the price down to $3,938.08. And we're asking the commission to go ahead and approve that, and we'll get them paid, and everything should be up to date electronically on the electronic code of ordinances.
I move that we approve payment to MuniCode for codification and update of the McPherson City Code Book for an amount not to exceed $3,938.08.
I'll second that.
All those in favor say aye.
Aye.
There are a number of wages for your consideration today. The first being Seth Graham, Fire Department Training Captain, going from $28.53 to $29.39, effective July 27th. Casey Hainline, Fire Department firefighter / paramedic, going from $15.85 to $16.33 per hour, effective July 27th. Kayla Jackson, Police Department Patrol Officer, going from $23.79 to $24.76, effective July 27th. Dusty Voth, Police Department Administrative Officer / DARE Officer, going from $26.29 to $26.82 per hour. Charles Brown, Police Department Crossing Guard, starting at $12 per hour, effective August 17th. All of these crossing guards will be effective August 17th, so I won't read that date, continue to read that date. Joe Cappuccino, Crossing Guard, $12 per hour. Dan Kate, crossing guard, $12 per hour. Shirley Gomes Jeffrey, I'm sorry. Crossing guard going from $12 per hour. Danny Elder, Police Department crossing guard moving to $12 per hour. Gary Eli, Police Department crossing guard, $12 per hour. Della, how do you say their last name? Keogh. Della Keogh, crossing guard going from $12 per hour. Michael Els, substitute crossing guard, $12 per hour. And Cheryl McVicker, Police Department crossing guard supervisor at $16 per hour. I know, as I mentioned, all would be August 17th.
I'd like to move to approve the wages as read.
Second.
All those in favor say aye.
Aye.
There are 4 bonds for consideration. The first is Industrial Electric Company Incorporated out of McPherson, $5,000 electrical bond. Paul's Incorporated out of Heston, they owe a $5,000 plumbing bond and a $5,000 gas fitter bond. Sutton Electric Incorporated out of Inman, $5,000 electrical bond, and that is your bonds.
I'd make the motion to approve the bonds.
Second.
All those in favor say aye.
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 Okay, I'd like to recess the city commission meeting and move into the study session. We're back in session, maybe? The city commission meeting, the first thing I'd like to do is authorize the police department to purchase 2,000 masks at $18.98 for $50 a masks. And so that means that they're going to buy 40 boxes of masks, and that we approve that to have them on hand.
I second it.
All those in favor say aye.
Aye.
The other thing I would like to do in relation to COVID-19 is, however we work with Sydney, I'd like to, as soon as possible, put out something, be it the hub or our own site, how to put on a mask, how to take off a mask, if you have a cloth mask, washing requirement, if you have a mask with a pouch that has a surgical mask in there, and you wear your mask 40 minutes in a day, can you wear it again for a second day, or do you have to take the other part out and go again? I'd like to put mask education guidelines on there.
I put some out actually a couple weeks ago, and we've been resharing it, but I can go more in depth about it.
Okay, yeah, we need to do that, as you saw the comment today, and I think we're weathering the storm somewhat, and I will say, one of the reasons why I supported the trigger is to give everybody a chance to mellow in their position a little bit, so that if we have to do this, that we are more unified as a community. And I hope that will happen. It's not an issue to be divided on. So I hope that we can come together.
Appreciate that.
Yeah, so, if you need anything from any of us, give us a holler, but the sooner we get something out on education, the better, and maybe we'll have to start putting a periodic thing out with a little tidbit. And some of the stuff on the hub that's old and not related anymore, I think could be taken off in anything, even on our website. But we'll do our best, and once we have that, Michael and TJ, with education things, you guys get a lot of hits, so let's put some education on masks out on both of your websites. And let's sort of talk to each other and to Sydney, so that when we're putting something out, we're all saying basically the same thing.
Yeah, even if it's a physical something, you stand here and show people how to put them on, and show people how to take them off, and show people how to adjust them, and the way they're supposed to be done. If it's a video thing, whatever, but we need to make sure that people understand.
Man, I'll never get there. I'm just adjusting to put my seatbelt on all the time.
Yeah. I know how to do that.
Yeah,
Is it possible to put those Harvard website boxes up there?
Yeah,
for
yeah,
people?
she has the Harvard Global, those boxes, right? Did you get
green, yellow,
the
and
green?
The link.
Yeah,
Yeah, you've put it out already.
it's out already.
I mean, people are gonna,
And I reshared it this morning, and I made sure to put it on the video as well, so everyone who watched, the, ordinance on Facebook today has that link, and it's.
Okay,
Okay.
So it's
okay.
been-
All right, thank you.
And,
Thank you.
and the other thing we might do is we might just work up a summary of what was discussed today that,
I
you know,
think that would be great, because there's a lot of confusion in the comments on Facebook.
I agree.
On what exactly happened.
that an ordinance would be passed in the event that we went to orange or red, and then we can explain that.
Yep.
Okay,
as well.
Janetta?
Is that Harvard link, is that updated daily?
Yeah.
Not daily, but every several days.
Yeah.
It just depends. Sometimes it looks like daily, other times it looks like every 2 days.
So I guess my question is, would be maybe some of the questions from the public. Who's monitoring that to know when,
We'll monitor it every day.
We're monitoring it every day.
okay,
And if you look at the link yourself, if you're out in the public, in the left-hand corner, there is a date
Yeah, right here.
that will say,
That date is on Saturday last.
yeah,
So,
and so does this data come from the states?
yeah, that's, it's similar to the Johns Hopkins Esri data, but Johns Hopkins data is more, what do you want to say, instantaneous once, soon as they get a report. This is probably not as big a staff and working a little bit slower.
I just thought we might know in case we get questions from the public.
Yeah, they can take the link that Sydney said she's putting out, and they can check it as often as they want, and the date up there on the left-hand corner will give them when it was last updated.
So will the county's information match this information? I know that's a lot of.
No, it'll be behind the county a little bit.
Okay.
I think it won't move out of the yellow quickly unless we have a lot of hospitalizations or we start to have a death. So we'll see how much people really want to keep their voluntary actions to slow this down. If it doesn't happen, then we'll have to make a move.
they've got some skin in the game now.
Yeah, they have a responsibility. If they don't want,
Exactly right.
they don't want to do it, then they keep on having parties to the north and to water areas and those types of things, then we'll have to make a move. But it gives them a chance. Okay, did I miss anything? Okay. Well, anybody else? Okay, I'd like to move that we adjourn the city commission meeting July 20th, 2020.
I'll second that.
All those in favor say aye.
Aye.
Thank you.